The United States is in a mental health crisis, according to the CDC. It's a troubling trend that experts say was only worsened by the COVID-19 pandemic. And Lexington is one of the many cities seeing the impact.
Data shows that a spike in suicides last year, and they're already seeing another this year. Tonight, WKYT Samantha Valentino is investigating the rise and the city's attempts to try and reverse it.
Our numbers are up this year from last year.
Fayette County Coroner Gary Ginn says his office has worked 18 suicides this year. 10 of those happened within the county.
It is a concerning factor in our community when you see numbers like this in Fayette County.
The coroner's office investigated 55 suicides that happened in Fayette County last year. That's the highest number they've seen in the past decade.
You have to remember that these are people, that these are human beings.
It's something David Hafley knows all too well. His son Tom was one of the 38 people who took their own lives in Lexington in 2015.
Tom suffered from significant depression. Early in his senior year at Tates Creek High School, didn't really see a way forward. And shortly after he turned 18 years old, he took his life.
David says his son's passing impacted their family and community in ways Tom never could have anticipated.
A suicide and a suicide as a young adult of anyone just ripples through hundreds and hundreds of people within their family and their circle of friends.
After Tom's death, David saw a billboard about New Vista looking for volunteers to work the 988 hotline. He completed the training and started taking calls.
And so many of the people that I talk to, I hear echoes of my son's struggles in mental illness and the pressures of being a young adult, and how hard it can be sometimes for people.
2,154. That's the total number of suicidal subject calls Lexington police responded to in 2024. So far this year, they've already responded to more than 500.
Oftentimes we're that first line of defense.
Commander Chris Cooper oversees the department's Bureau of Training and Wellness. He says they train their officers to be ready for anything. That includes interacting with a person in a mental health crisis. Lexington police undergo 40-hour crisis intervention training.
Not only do you learn about what different mental health scenarios or afflictions may be that people may be suffering, the citizens that we encounter out there, but also ways to recognize and then ways to basically deal with those situations.
Commander Cooper says a lot of the training is rooted in empathy. Officers also go through de-escalation training separate from CIT, learning skills that are often necessary when working a mental health call.
We really try to portray the demeanor that you would want the person in crisis to portray. So keeping that calm voice and being collected, trying to reason.
As of a few months ago, when someone dials 911 for a mental health call, the city's new crisis response team responds along with police.
We'll meet the police and the engine or one of the ambulances on scene.
Christopher Perrine is a full-time licensed therapist who now works as a crisis responder.
I can do a clinical assessment, determine what their needs are, whether they need to be transported to the hospital for suicidal ideation, if there's any psychosis or behavioral health needs.
The goal is to provide the least restrictive form of care.
That could be safety planning, that could be helping the individuals get signed up with outpatient PHP, IOP treatments in the area in Lexington.
Perrine says the hospital isn't always the best option for someone in a mental health crisis, which is why the crisis response team meets people where they are. In Lexington, Samantha Valentino, WKYT.
Well, if you need help, you can always dial or text 988. That is the Suicide Prevention and Crisis Lifeline. We'll also have information about more resources inside this story in our WKYT News app.